You can actually put in a stent in the neck.
You can.
So tell me about how you do it, what the indications are, who you select, why you select them.
So you decide if you're going to treat the artery based upon its degree of narrowing and whether it's causing symptoms. And once you've decided that you're going to treat it, you can pick a stent or an endarterectomy. Generally speaking, stenting is reserved for higher risk people whom we don't think necessarily are good candidates for surgery based upon their anatomy, radiation, other factors, if they've had a surgery in that neck area before.
So in general, when you've given medical treatment and you're going to select a surgical treatment, your first thought's going to be endarterectomy. But a stent, tell me how you put in the stent. It's people that are having more serious problems.
So to put in the stent, you can either do a puncture in the groin artery like we would for a heart cath or any other catheterization, or you can actually do a little baby incision in the neck and put it in directly in the carotid artery.
How big is the baby incision?
A couple centimeters.
Okay, almost an inch right there. How difficult is it when you make a little incision or when you go from the groin to find the area that you want to find? How do you know you're in the right place if you're going to put a stent in?
You put a little tube up into the aorta and you put some contrast into those vessels, and you look at all the vessels and you can see where the narrowing is, and that's where you decide where to put your stent.
Is it easy to see that when you put in a dye and you can look and see? So you know,
very easy.
Very easy. You know where you are. Are there some dangers of putting in a stent?
There are. The biggest dangers of putting in a stent would be probably a piece of something breaking off and going up that artery to the brain before you had control of it.
So you're trying to open up the flow, and when you put in a stent, what's a stent look like?
A stent looks like, I brought one here. This is bigger than you would put in the carotid artery, of course, but just so that you can see, it looks sort of like a cylindrical piece of fencing, really. It's very flexible, so it can bend with the neck or wherever you put it. And it has a little bit of radial force to help keep the artery open.
So I've always said a stent looks like a slinky, and we talked about a type of finger trap, it almost looks like too. But it's very flexible and allows you to wiggle your neck, and that's opened up the flow of blood that's going up to the brain. Correct. Which is very, very important.
Which is important.
So how do you keep a little bit of the hardening of the artery from while you're putting in the stent of going up to the brain, jumping ahead? What do you do?
We put in a little upside down basket that catches the pieces of debris that could go up to the brain.
Has that got a name, that upside down basket?
We call it distal embolic protection, but there are multiple brands which I won't name for for those purposes.
Distal embolic protection.
It's an umbrella.
Yeah, and are they pretty effective? How often does a little piece of the blood vessel break through and get stopped by that umbrella?
Once the umbrella is in, you're fairly safe. Not 100%, but very safe. It's the getting of the wire and the umbrella beyond that before you are protected, where your risk is.
After you put in the stent, do you pull out the umbrella?
You do.
And when you pull it out, can you see if there's if it's caught anything that you didn't want?
Yep, you always look.
You say, boy, I'm glad we put that in there at that time. So what are the problems with the stent?
Problems with the stent really are the same problems you would have with a stent anywhere, which is that the scar tissue can grow in between the stent sort of pieces. And so scar can grow in between there and can cause what we call stenosis or in-stent restenosis. And so the stent has to be monitored for life.
So do you monitor it with an ultrasound?
You do.
Does the metal in the stent, does it keep the ultrasound from penetrating, bouncing back, telling how big the hole is or if it's getting smaller?
It does not. You can see it. It is a slightly different color than the normal artery wall, but the artery sort of adheres to it and you can see through it easy. I
think that's neat. To me, that's such an exciting thing to be able to do to somebody that's got an impending stroke, whether they like it or not. There's a good chance that they would get one.